You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Hello and welcome. You're listening to the ATS Breathe Easy podcast with your host, Eddie Qian. World TB Day is coming up on March 24th, and in recognition of that, today we'll discuss global tuberculosis and its impact here in the United States and abroad. Joining me today is an internationally recognized expert in TB, Dr. Philip Hopewell. With funding from USAID, Dr. Hopewell led the development of 3 editions of the International Standards of TB Care, a set of evidence-based guidelines on the fundamentals of TB care and control that have now been endorsed by dozens of national and international organizations and ministries of health. Welcome, Dr. Hopewell.
Thank you.
So I just wanted to start off with, I think more in general, I think a lot of our listeners are coming from the United States. Why should physicians in the United States or other high-income countries be concerned about TB? Overall, we have very few cases here.
Yeah, well, let me start with a personal example of why we should be concerned. I was attending in the ICU. It was a few years ago. We admitted a patient, a 74-year-old woman who was admitted with hypotension and diffuse bilateral opacities on her chest film. We assumed that she was septic, probably from a bacterial pneumonia. We started treatment with pressors and broad spectrum antimicrobial coverage, and she did not do well. We subsequently got additional history that she had a history of rheumatoid arthritis. And about 3 months prior to admission, had been started on a TNF alpha inhibitor. TNF alpha inhibitors are potent risk-inducing drugs in terms of risk for TB. And there's a black box warning on the TNF alpha containers that says you should do a tuberculin skin test or a interferon gamma release assay before starting. And her physician did that. It was negative. Turned out that she was on prednisone at the time, and so that was probably a false negative. As I said, she didn't get better with our usual antimicrobial coverage, and a tracheal aspirate showed acid-fast organisms. She basically we started antimicrobial anti-tuberculosis therapy, but she didn't do well and then died a couple of days later with basically disseminated tuberculosis. She had 2 risk factors for TB that clinicians need to be aware of. One was TNF, as I mentioned, a TNF alpha inhibitor. And the second was that she was from China, which is a high incidence country. But again, this illustrates the kind of catastrophic disease that can occur, and that we need to remain vigilant, even in a low incidence country such as the U.S., that TB is always around.
Yeah, no, I think a lot of our clinicians, we learn a lot about TB, and I think it's fair to say that though we don't see TB very often, that I think most clinicians in this country have had cases or have seen cases of tuberculosis, even though it's not that common here. I did some of my training in New York City, where we saw a fair amount of TB cases there. And I said that there's few cases here, but I mean, as I talk, I've read in the press that there's an outbreak of TB in Kansas City, so right in the middle of our country. What do you know about the situation over there?
Well, I don't know much about it. So far as I'm aware, there's been nothing written about it except in the lay press. It appears to be an outbreak that's been going on for at least a year, and has involved at least 70, maybe a bit more cases, and I think 2 deaths. I know that CDC has been involved in providing assistance to the both the Kansas City Health Department and the State Health Department in Kansas. I know that with the CDC assistance has been a lot of help in getting appropriate laboratory studies done, molecular testing for drug resistance, and genotyping of the organisms to be able to track them through the community. But there's not been anything that, as I say, I'm aware of that's been written. It would be sort of unusual for an outbreak of this size not to be described in MMWR, the CDC weekly report, but it hasn't been there. Interestingly, about, I don't know, 3 or 4 years ago, there was another outbreak in Kansas, not in Kansas City, that involved transmission of multiple drug-resistant organisms within a fairly closed group of people. And the index case was actually a baby with tuberculous meningitis that turned out to be drug-resistant. That brings up a whole another set of problems because of the generally the difficulties in getting prompt resistance testing and appropriate therapy into patients quickly. Why Kansas? I have no idea. It is they usually report 30 to maybe as many as 50 cases a year, but it's a very low incidence area. There are a couple other outbreaks that are very interesting and are illustrative of the kinds of things we might see here in a high medical resource setting. 2 different outbreaks. One, the most recent one was in 2023 of TB caused by using bone allograft material in spinal fusion surgery. And each of those cases, the allograft material came from donors who should have been recognized as having TB, but weren't. And in the second outbreak, there were, I think, 36 people exposed. 36 people had the surgery that had used in which the material had been used, and there were 10 cases and 2 deaths. Again, catastrophic results from failure to recognize TB here in a very low incidence area. So all that says is that we do have to maintain our vigilance, even though we're not seeing that many cases, and many clinicians will never see a case of TB in the U.S.
You had talked a little bit about it's really important when we have these different types of outbreaks here for their variety of reasons that we have high vigilance, as you said. And in your case example, when I asked at the very beginning, you mentioned that you had a patient who was born in China, which is a high TB incidence country, and they have a much higher rate of TB than people born in the United States. What kind of comments, or how can you talk about the TB as a global health problem outside of our borders?
Well, to put it succinctly, it may surprise people, but TB is the number 1 infectious killer globally. It far outstrips HIV as a cause of death. And in fact, most deaths in patients with HIV globally are caused by TB. For a good while in the sort of 1980s, early 90s, TB was thought to be a disease that was vanquished, that we knew what to do and were doing it. And so there was very little attention being paid at the global level. The World Health Organization staff for its TB program in 1989, 1990 was 2 people. In the early 1990s, they got a new director of the TB program, and through some finagling and sort of using ways of manipulating WHO to designate emergencies, they managed to get TB designated as a global emergency in 1993. And beginning with that, the TB program began to enlarge, funding increased. The U.S. had not had any involvement with global TB, at least not through foreign assistance, until 1998, when USAID first received some TB-specific funding. But basically, the TB program expanded. One of the really important things they did was expand the epidemiologic and data management systems so that they could have a much better handle on the total number of cases and where they were in the world, and began to prompt, if not to say prod, countries to contribute more, to pay more attention to TB within their boundaries. As the recognition increased that TB was a major global issue, funding progressively increased, largely from the U.S., but also from the countries themselves. And money for TB research also began to increase. So there have been a lot of advances in TB research that are applicable globally.
You're talking about different types of research advances. I know that from my point of view as a clinician, following some of these guidelines and other different types of management of TB, even since I've taken my board exam, some of these things have changed. What kind of research advances relevant to low and middle income countries have there been that have been aiding this effort?
Yeah, so there's been a whole range of research advances. One, I think, relates to general health services in countries, and that is that work done by Daniel Qian, who I'm proud to say was a former fellow of mine, looked at the alignment of services, service availability, and where patients sought care, and found that there was a fairly gross misalignment. So countries have been increasing their attention on service availability and aligning services for TB was specifically what was looked at, but that really affects the whole healthcare system, but aligning their services with where patients seek care. Some really game-changing advances, the development of PCR-based tests to identify Mycobacterium tuberculosis, and at the same time identify whether or not rifampin resistance was present, have made a huge improvement over old culture-based methods that required 6 or 8 weeks to get an answer. New drugs have been introduced, some repurposed drugs, some of the fluoroquinolones, for example, linezolid, have been repurposed and incorporated into TB regimens. That has resulted here in the U.S. in new recommendations from ATS, CDC, IDSA, and the European Respiratory Society, new recommendations for treatment of both drug-susceptible and drug-resistant tuberculosis.
Yeah, and I know so many of these treatments using some of these newer repurposed drugs are a lot easier to take as far as the durations and the time that it takes to treat these diseases, which I think is a big deal.
Yeah. The most recent recommendations, for example, shorten the course of treatment for a usual case of tuberculosis with drug-susceptible organisms from 6 months to 4 months. When I was learning about TB, the treatment was 18 to 24 months. And it was not pleasant, and the drugs were hard to take and caused a lot of side effects. So there have been major advances in treatment.
That's a year and a half less of different types of side effects of monitored doses and monitored therapies. I mean, I think it's a big deal, and I feel like it keeps advancing. And we'll be right back.
The ATS 2025 International Conference returns to San Francisco, May 16th to the 21st. Members get a discount on conference registration, so become an ATS member or renew your membership to take advantage of these savings. At ATS 2025, you can network with colleagues, find your next research collaborator, listen to patient stories and get inspired, and be among the first to learn about breaking news in pulmonary medicine. Register now to attend. Go to conference.thoracic.org today.
You have pointed out a lot that, this TB care and control at the global level has resulted from increased funding for implementation as well as for TB research. In the current milieu, research funding seems to be in a constant state of flux, which I can't really hope to predict what the future will bring. How does this uncertainty impact the management of global TB?
Well, there's definitely uncertainty, and particularly now, there's major uncertainty. I'll talk about in a minute. But there's been a progressive increase in funding for TB research. It's been estimated that approximately $5 to $6 billion a year is the target for the total investment in TB research, and about 25% of that goal has been reached. So even though there is apparent underfunding, the field continues to advance, and new tools and drugs continue to be developed. That's not to say that there shouldn't continue to be funding and further developments. That a TB vaccine, for example, is a major goal, which is the focus of research in a lot of laboratories. And give credit to the Treatment Action Group. Treatment Action Group was developed as from a group of AIDS activists in the early 90s, and they now focus on tuberculosis as well, and they've done a very good job of tracking and quantifying TB research.
Yeah, no, it really seems like this is a critical time point in TB, from saying in the 80s, as you had mentioned, where, TB is something that we don't have to think about. It's a vanquished disease, to being a global emergency in the 90s to where we are now. Where are we as far as our kind of global health control and research and funding for TB?
Well, it's really in a very much a state of flux right now. I mean, things look really bad. The current administration's approach to USAID, which is in essence dismantling it, it's not clear what the outcome will be, but quite clearly a number of programs worldwide are going to take major hits. The U.S. is the major donor to global TB control, major source of foreign assistance to both multinational organizations like WHO that we're now in the process of pulling out of, and as well as to individual countries. And if you look at the amount of funding that's used by TB control programs country by country, there are many countries in the world where foreign assistance funding is a major part of their funding for their TB control programs. So in Nigeria, for example, about 80% of the program funding comes from international sources, most of that from the U.S. So it's a big problem, and it's I'm concerned that the lack of funding will result in lack of service delivery, which in turn for patients with tuberculosis means erratic drug taking, erratic drug availability, and lack of supervision to ensure that drugs are being taken at regular intervals as they should be. And that is the setup for increasing drug resistance, which, again, is a really major issue and much more difficult and more expensive to treat. So it remains to be seen how the world is going to deal with the U.S. with basically withdrawing from leadership in funding and technical assistance for global health.
Yeah, no, I think that's all. Those are all really important things to bring up. A lot of these are kind of happening over the individual, an individual who might be listening to this podcast. What kind of things or organizations or other types of activity can a person like you or I get involved with or show our support if we wanted to show our support for global health, TB funding or otherwise? And then also, I guess a related question, is there any different types of books or other resources for anybody who's listening who is interested in learning more about the global fight on TB?
It's as it's been described that current administration is flooding the zone with so many changes, usually based on executive orders, that it's hard to kind of know where to focus at this point. There is, and in fact, there was a demonstration organized by Stand Up for Science with scientists from all areas uniting to demonstrate against the reduction in funding for science and the threats to NIH and so forth. And I think people in the street is often an effective way of getting attention. If one wants to get, well, there's several avenues you could pursue to get more information. One, highly technical information, but very well written, is that the WHO's annual global TB report. They do a really nice job of putting together all of the data, very detailed country data, but also the big picture with a lot of graphs and a lot of data. So it's very well done. CDC similarly does a tuberculosis in the United States report that comes out, ought to be coming out pretty soon, actually, in March of every year. And then there are some books for the lay public. The John Green book that's just now hitting the bookstores called Tuberculosis is, what is it? Everything is Tuberculosis. I've not read it, but it's said to be quite good. And also a book describing the care of TB patients at the Seaview Hospital on Staten Island in the 1930s, where the nursing staff was largely recruited from among Black nurses from the South who couldn't get jobs anyplace else, and they served as the nursing staff for the TB hospital, a very big TB hospital on Staten Island. Very, very good book, interesting culturally and medically as well.
Yeah, I think that book was called The Black Angels. Is that
Black Angels?
Right?
Yeah.
Yeah, I've heard them. I've heard the authors speak on that book conferences. So those are all interesting, and I think for the listeners, we'll have some of these titles and other resources and linked in our show notes as well. Dr. Hopewell, is there anything else that you wanted to touch upon that we haven't touched upon yet when talking about TB and global TB?
Well, I thought it might be interesting just to provide a bit of a sense of scale regarding how much money we actually are spending to support or have been spending to support global TB. I looked at the budget for the San Francisco Department of Public Health. I worked at San Francisco General for 50 years. I'm very familiar with San Francisco General as well as the Department of Public Health. So the amount of U.S. funding for overall global health assistance is about $12.4 billion per year. It's been that way for the past few years. The budget for the San Francisco Department of Public Health is $3.2 billion, so about 25% of the assistance, global assistance for health. So about, for a city of about 850,000 people, their budget is about a quarter of what the whole U.S. government foreign assistance for health is, and for TB control, it's about the amount for TB control is about 4.6 million, and that's really much smaller than the public health department budget in San Francisco. So when you look at these in comparison to expenses in the U.S., they're really trivial expenses, and yet have made a major difference in control of TB globally.
Yeah, no, I think that scale puts a lot of things in perspective. Thank you for that. Anything else that you wanted to bring up, Dr. Hopewell?
No, I think, things are in such a state of flux right now. It's just hard to know how to go.
Yeah, I think it really is. I think a lot of uncertainty makes it difficult, not just from TB and otherwise, but I think in a lot of realms of our lives. So, but I think overall, otherwise, I'll thank everybody for joining us for today's ATS Breathe Easy episode. Thank you, Phil.
You're welcome. Enjoyed it.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.